Hello everybody, my name is Dr. Lorian. I am a maxillofacial surgeon and I am the head of ZAGA Center Tel Aviv. ZAGA Center Tel Aviv is a maxillofacial center licensed for general anesthesia and dedicated to treating patients with bone deficiency using all available means. Today we're going to talk about the differences between the pterygoid implants, zygomatic implants and regular implants. We're going to show the benefits of the pterygoid implants as a tool in order to improve our stability of the final prosthetic work, and a tool that it's not aggressive relatively as the zygoma, and it's quite similar with the regular implants with excellent results. Let's do it. The pterygoid implants are regular implants that are modified to be used in the pterygoid area. There are not new devices. Those devices were developed in the 80s and we know them with a lot of background and evidence-based data. The pterygoid implants are placed in the posterior area of the maxilla, so they are a little bit similar to the zygomatic implants but differ by the shape, angulation and the length of them. They are shorter and then can provide a good support for the prosthesis. The patients with severe atrophy can benefit from those implants which are less aggressive than the zygomatic implants. Of course, they can benefit if the surgeon and the prosthetic team knows and appreciate that they will gain a good stability and then can be used further for the prosthetic rehabilitation. The pterygoid implants eliminates the need for bone augmentation, and one of the most complicated bone augmentation in this area is the sinus lift procedure, which is much more complicated with a lot of morbidity for the patients. Second, the big advantage is that we can immediately load them under certain condition, and this can shorten a lot the time that we can provide the temporary bridge, sometimes 24 hours. They also eliminate the long time that we need to wait after bone augmentation, and usually without providing any provisionals, so not only the immediate but also the final prosthetics can be done very fast, almost in the conventional way with the regular known implants. If you do a sinus lift with bone augmentation and let's say 2 or 3 implants, the cost of the procedure is higher than a pterygoid implant, even that you charge for the pterygoid implant more, but you don't charge like 3 or 4 times more. What is this? The pterygoid implant is placed as a regular implant and it can be placed in a dental clinic. It doesn't need any support from a special hospital or clinic. They are placed just like a regular implant. It is interesting that a good placement for a pterygoid implants reduces a lot the morbidity for the patients. Therefore, sometimes the recovery after one pterygoid implant is much easier than recovery after sinus lift or regular implants. The pterygoid implants are more complex in terms of the surgery and rehabilitation. Therefore, you should choose the team that it's experienced, professional and had the proper training, although the outcome it's the same like the regular implant. The success rates are very, very high. They are close to the regular implants. Pterygoid implants are definitely an excellent solution for bone loss in the posterior area of the maxilla. There is no medical device that it's lifetime. Sometimes patients get wrong indication or wrong explanation regarding the length of the life of this type of devices, regular, zygomatic, pterygoid. The lifespan of these devices is between 12 to 18 years with the proper follow-up and hygiene and on-call follow by x-rays and the doctor that placed the implant. We are talking about patients with severe atrophies which what we called, they have like a terminal dentition or no dentition at all. Therefore, we have to do the correct steps in order to recover them, and by meaning this is to use as much as possible hardware, which means implants, in the mouth in order to sustain the prosthetic and the final restoration as long as possible.